Cervical cancer is a cancer of the cervix, the lower portion of the uterus or womb. The cervix is the part of the uterus that opens into the vaginal canal and dilates during labor. Cervical cancer is the most common cause of cancer-related mortality amongst women worldwide. In the United States, approximately 13,240 women are diagnosed with cervical cancer annually, while approximately 4,170 will die of cervical cancer every year. Patients who have cervical cancer that is caught in early stages have excellent survival rates. 92% will survive through the first 5 years after their diagnosis. The main reason for improvement in cervical cancer outcomes in the United States is through the use of pap smear screening, which allows for the diagnosis of precancerous conditions and then treatment before cancer develops. Cervical cancer will most often affect women in their 30s, 40s, and 50s. However, more than 30% of cervical cancers are diagnosed in women over the age of 65. Cervical cancer is caused by a persistent, long-standing infection with high-risk strain of human papillomavirus, or HPV. HPV infections are very common. The majority of people who have been sexually active with any skin-to-skin genital contact will have become infected with HPV. Most HPV infections cause no symptoms and do not lead to cervical cancer. Approximately 13 types of HPV infection are considered high risk for causing cervical cancer. HPV 16 and 18 are the two most common high-risk types seen in association with cervical cancers in the United States. HPV vaccination can prevent HPV infection prior to the onset of sexual activity and therefore reduce the risk of developing cervical cancer. It is easy to reduce the risk of cervical cancer by using screening tests such as pap smear tests and HPV testing. The pap test takes a sample of cervical cells to determine if any of the cells are abnormal. Abnormal pap smear results may prompt further workup, including biopsies of the cervix, which may find either precancerous changes or cancer itself. Most cervical cancers in the United States occur in women who have not had a pap smear recently. In these cases, precancerous cells have had the time to develop into cancer before being caught and treated. HPV testing can help determine if any of the high-risk strains of HPV are present, allowing for increased surveillance for cancer if they are.